So if you have inner knee pain, there's a strong chance you could be stuck in an anterior pelvic tilt. And that means when your pelvis is tipped forwards like this. Now, the reason that can cause inner knee pain is because if your pelvis is tipped forwards, that means that your femur, your thigh bones then are also stuck in internal rotation because they can't access full external rotation. And when they're internally rotated like that, that can cause the pressure to go through rather than directly down into the ground. It goes through the inside of your knee in this direction. And when you expand the inside of the knee, that's what can cause pain. So we need to get the pelvis back into neutral so it can access anterior, neutral, and even posterior. And then you have all the options and movement availability at the pelvis. And therefore you'll have a femur that can access internal and external rotation, which means when your knee needs to bend, it can bend and rotate as it should, and therefore keeping the synchronistic sort of mechanics and movement so that the forces go through the leg into the ground as opposed to out through the side, expanding the inside of your knee. So I hope I was clear, and it's hard to demonstrate when I haven't got a skeleton. So, or I have, but you can't see it. So I'm going to follow up this video with a way for you to assess to see if this is the case for you. And then I'm also going to show you what you can do about it and then reassess to see if there's been any improvements.